everybody. Welcome to David and Johnny Live. This is the COVID-19 update. It's been a couple of weeks since we came to you providing some information around the COVID-19 pandemic that we're all experiencing here around the world. I just want to say that we appreciate you. We thank you. If you found our last video inspiring, uplifting, if you found any of the information that we provided helpful, make sure you take the time right now to like this video, share this video, comment on this video, and make sure you subscribe to our YouTube channel right here. So I want to take a moment to introduce the other half of the David and Johnny brand. Johnny's going to be our technical correspondent, making sure everything is running right and fielding your questions. Say hello to everybody, Johnny.
Hello, how are you all doing?
You all seem any handsome, y'all. Isn't he handsome? Yeah, so he is in another room in our house because we want to make sure that we let you all know that it is possible to distance yourself if you must in this time that we are facing right now. I want to take, again, say thank you to Johnny for doing all of the behind the scenes work. We could not do any of this without you. So I want to go further and introduce again the doctors for our live today, Doctors Victor and Sherry Blake. And I'll give them a moment to introduce themselves and let you all know who they are and what we'll be discussing today. Just intro, Dr. Victor, can you give us a start?
Yeah, I'm Dr. Victor Blake. Although these views don't reflect the opinion of Morehouse School of Medicine, I am an associate professor of clinical medicine at Morehouse School of Medicine. So I just want to be clear that we're going to be giving some views, but these views are our own.
Thank you so much, Dr. Victor. Dr. Sherry?
You say?
Yeah,
Okay, I heard a disclaimer. Okay. Okay, you did say. Well, I guess that's my turn. Hi.
Yes.
I'm the other Dr. Blake. I'm Dr. Sherry. As a clinical psychologist today, I'm really concerned in terms of the psychological impact. And so I want to update in terms of what I see in terms of that. You may have seen me, as I've said many times before, on TV. I'm not just a doctor I'm not a person on TV playing a doctor. I am a doctor, and I'm married to a doctor, an MD.
And so am I. I'm a doctor too.
Oh.
You two are absolutely adorable. So I want to make sure that I jump right in. So in the last couple of weeks, we've gotten so much information, whether it's conflicting information, the same information. We've been bombarded with information around COVID-19. So we understand now that there are more people who are at work who are now working from home, Dr. Sherry, and they are having to be not just full-time employees, but full-time parents. Now that the schools have effectively closed down the class sessions in person for the rest of the school year, what is some advice that you could give to all of the stay-at-home parents, the full-time employees now who are just trying to make it work?
And you know what's funny? Not only are they stay-at-home employees and stay-at-home moms, now they're short-order cooks, they're teachers, they're a little bit of everything, you know. And I am sure many of them are ready to scream. That is normal. What I suggest to you is go outside, let it out, come back in. And if you have close by neighbors, you don't want to scream too loud because then they'll think something's really wrong over there. So what I suggest you do is find some me time. Really find some me time to just sort of decompress. But most of all, establish a routine. Establish a routine for everyone in the house, which means that you have a space that you can go to from 9 to whatever. I'm going to be here doing homework. I'm going to be over here doing my work. Dad's going to be doing his work, or whoever else is in the house. Take breaks. Give yourself an opportunity to just breathe and just really take the breaks you need. But most of all, take this time to become a family, become a unit, understand each other, talk to each other in terms of things that you didn't talk about, because it is stressful, it is real. Also, most of all, take time to grieve, because this is a different life. We're grieving loss of weddings, loss of graduations, loss of football games and little league and all the other things. That's normal and it's sad, but how do we do something different? How do we make sure it's different in that process? Because otherwise, it is very depressing, and that anxiety and that depression can become unmanageable if you don't take control of it.
And I completely agree. And I know that we take a lot of time to deal with the adults in the home. I want to make sure that we also take a look at the emotional stresses for children, because they're also grieving right now. They can't see their classmates. They're not. The class of 2020 is effectively gone. There's no graduations. There is no highlights or the end of something for them. So how do we deal with the trauma that some of the children may be experiencing?
One of the things I tell parents, talk to your children. They experience things. They may not share their feelings like you share your feelings, but they're experiencing the stress, they're experiencing the loss. So sit down and have a conversation with them. Depending on their age, depends on how much you want to explain or how you want to explain it. But most of all, give them a time to be heard. A lot of times we assume children are okay because, they have clothing and shelter and all that good stuff, but they need more than that. They need the emotional support. So what you do is really take time to hear them, hear their feelings, process that with them in terms of talking to them about it. Also making suggestions as a group, as a family group. What can we do given we can't go and see your friends? Maybe we can FaceTime them. Maybe we can do a group chat. Maybe we can do some other things. So include them in what you do and make sure that they realize that although it feels like a vacation, it's really not a vacation. So given that, there are rules and there are things we have to do to keep things moving forward. And they feel your stress. So remember that. So when you're stressed, they're going to feel it.
Gotcha. Dr. Victor, this one's for you. The news, like I said, is bombarding us every day, all day. Some of us can't turn it off. No matter what we do, no matter what channel we turn to, we just cannot get away from the news. And one of the things that I've heard now that is pressing is opening up the country again. In your personal opinion, in your medical professional opinion, do you think that is a wise decision to do now?
Well, writ large, to open up the country right now would be crazy town. But having said that, being that the disease is peaking in different places at different times, at different parts of the country, some type of phased opening will be is going to be logical. And it sounds like that's where they're moving. The scientists that are involved, the politicians say one thing, but the scientists that are involved really understand that this can only be done safely by doing it in a phased manner, which means that the areas where less population, where you have less impact, where people are more likely to actually just naturally socially distance, they might be able to do it in levels. In the population centers, that's where it's going to be the most difficult. You probably will start seeing things start to open up, actually change in terms of hospitals. Right now, we're looking at starting to do elective surgeries and elective procedures now. So it's going to be a phased process, which is probably going to be over a number of months. I know that there are those who would like to see it open. Tell that to I want to tell that to the people who've lost someone in this process. It'd be not easy to say open it up when you haven't lost anybody. But when you've lost it, and I've seen this happen, that's as we all know, that's a whole new kind of pain when you can't share it and even celebrate the person's life.
So, even given that, Dr. Victor, you said something about the phased approach, and you talked about the impact that it's having. Can you also tell us a little bit about why you feel that the virus is so disproportionately affecting the African-American community more so than any other community?
There are several factors to go. It's not simply you'll have those folks that will say well, it's just racism. It's not that simple. It's really, certainly race plays a role, because race plays a role in where you are socioeconomically.
Yes.
If you are working, many of the people that are working in the hospitals, doing those maintenance tasks, picking up the garbage, working in the supermarkets, working on those are frontline people too. And I want to give big ups and big respect to them, because I can't do my job unless they are doing their jobs. She can't do her job unless they're doing their job. So I really think they're the unsung heroes. But a significant amount of that population are going to be African American. And so that by itself, when you're amongst the people who are doing the more basic tasks, such as maintenance and what have you, a large amount of them are African Americans. That's going to impact it anyway. I spoke to a young white woman actually in the supermarket, and economics plays a role too, because she was saying, well, isn't this just some kind of super flu? And I was trying to explain to her, no, it's not a super flu. But when I told her about social distancing, she said what many things we hear from anybody in her economic situation would say is that, I can't afford to take off. I can't afford to get sick. I've got to come to work.
One of the things I just wanted to add to what you were saying is that what happens is, in the African American community, we have to keep in mind that we're disproportionate. We have the things that are like obesity, diabetes. We have those health things in a disproportionate amount that already sets us up for tragedy and for more critical care. And so when I say that because, when I used to say, when America gets a cold, we as African Americans, we catch pneumonia. And this is an example of that. And it does hit us harder. Not only are we the frontliners in many incidents, but we already have a lot of those medical problems that are predisposed.
I do want to talk about that a little bit more.
And they are behaviorally connected.
Which are behaviorally connected. Trying to draw a straight line as possible with this. People of color, or people of color, or people of color, people who are people in rural populations, what have you, have a long history of not really being comfortable with the healthcare system. We have a high incidence of heart disease in the African American community, high incidence of asthma, say, especially in the Hispanic communities, COPD, cigarette smoking, all those things. Obesity is an inflammatory state that puts you at risk for getting for the inflammation that develops in your lungs that ultimately kills to happen even faster. So all these things kind of go into one big ball of just kind of perfect storm that's going to result in seeing that African Americans, people of color, people who don't really have a choice to work. So yes, race plays a role. It plays a role that's not deniable. It's obvious. You see who's dying in higher proportions. You get to see who's dying in proportions, but the behavioral stuff, the notion in our communities a lot of times is, and I hear this all the time with patients, is that, I say, well, you need to do this procedure to prevent so-and-so, the concept of preventative care, right. The concept of coming in and taking care of yourself before you get sick. Well, I'm not sick now, I feel fine. And a lot of times we don't go to the doctor, we don't go to the doctor unless we feel bad, and
right.
A lot of people actually being kind of discouraged. There's a thing out kind of discouraging people from going to the emergency room, and people are afraid to go to the emergency room. Folks didn't want to go to the emergency room at the first beginning, and now people are afraid to go to the emergency room. People are waiting too late. So there's actually going to turn out to be an uncounted number of deaths that are occurring that are not related to coronavirus, but related to other medical conditions that people would have gotten looked after if they went and said, well, my patient told me all the time, well, I can't go there. That's where the virus is. Well, the hospitals have, at least my hospital, our hospitals that we work at, they have the areas quartered off and warded off. Yes, there's a high incidence, but if you're having an asthma attack, like a person came in yesterday, asthma can turn on you in 4 minutes. You got 4 minutes, and that's it.
Yeah.
Yeah.
And so you all mentioned something really poignant, and I want to make sure that we drive that point home, and that is the pre-existing conditions. And so I know that we have heard on any of our media outlets about the conditions that you named, Dr. Victor, but then also, Dr. Sherry, I wanted to ask you, is people who were going for counseling before the COVID-19, who are not able to go and see their psychologist or their counselor now, they may be exacerbating issues that they were trying to deal with on their face-to-face with their doctors before, but now they're in a position where they are probably panicking even more now. What would you say to them?
Well, the good thing is with what I do and what a lot of the psychiatrists do, we can do telemedicine. And we're switching over in a large number to a format where you can do Zoom, you can do other formats visually. And that is so important because we don't want people that were especially struggling with depression or anxiety or other life challenges not to get the help they need, because they're going to need this support now more than ever because everything has exacerbated. So it's very important for people to understand that this is not the time to run away from help. This is the time to get help. And now we have telemedicine, teletherapy, we have everything. You can FaceTime, you can, do a lot of things, but stay connected because it is frightening and it's easy to isolate. It's easy to say, I'm not the only one. And so we're all going to just, panic together. And that's not healthy.
Gotcha. And even in staying on the topic of pre-existing conditions, Dr. Victor, I hear a lot in a certain community, especially those who are living with HIV, which we know is a pre-existing condition, and them not understanding the effects that this virus can have on them. Mm-hmm. So can you talk a little bit about the effects that this virus could possibly have on people living with HIV in particular?
Well, it's very interesting. You should kind of pinpoint that about folks living with HIV. And I want to come back to something we didn't talk about the last time, and that's nutrition, but I'll come back to that in a minute.
Okay.
When your immune system is not functioning as well as it should for whatever reason, but we're talking about HIV right now, it does put you at higher risk for certain types of infections, particularly when you get a viral infection. It has what we call the opportunity. A lot of people have heard of the term
opportunistic.
Because your immune system is not as strong as it should be, these viruses have the opportunity to get in and multiply at a higher rate unchecked by immune system that's not working as well, which just emphasizes the importance of watching, of being careful with the hand sanitizing, with the mask wearing, with the eye protection, the things we talked about last time. At this point, I'm not seeing a major negative impact amongst my patients who are HIV positive. Maybe because my patients are, of course, my patients communicate with me.
Mm-hmm.
I think it's important to realize that patients that don't have a provider to communicate with, it's just them in the emergency room, My patients communicate with me. My patients with HIV communicate, but to understand why this infection will have a greater opportunity in those patients. Again, as I said last week, there's good research going on that may imply that some HIV medicines may actually help protect, but that doesn't mean that just because you may happen to be on medicine for HIV, that doesn't mean, I can just go run out and do whatever. No, that's not what you do. What you want to do is you want to observe the same precautions, be important. We're finding out that diet plays a role in inflammation in your body. Fats, carbohydrates, stuff like that increases the level of inflammation in your body, and inflammatory chemicals right now. And this is a challenge with this virus. So we're still learning. So what I say today might not be even correct next week, but right now we're learning this virus kicks off your lungs into starting. It's just what we would call a super inflammatory process. The $50 medical word is cytokine storm, but that's a $50 medical word. Don't worry about that.
That's $100.
Don't worry about that. The point is your lungs start eating themselves, and
wow.
to the point where you get so much damage that even our respirators is just not enough. So I think I'll leave from there, because I think that this is so much behavioral part with this.
Yeah.
Bounce it back to
Well,
this.
is behavioral in that a lot of times we don't do the things we can do, like wearing the mask. I am so surprised how many people I see out in public without a mask on, in the grocery store, without any protection whatsoever. I am so alarmed by how many people I see with children out without masks, without any protection. So it's the whole idea that this idea of prevention, we tend to wait until the last moment. We tend to wait until there's a problem.
That reminds me. When we used to talk about when we talked about transmission of HIV, we always said, avoid risky behavior.
Yes.
Unprotected sex with persons that you don't know their history, don't know what their status is. So avoid risky behavior. In this case, in the case of this coronavirus,
it would be the same thing.
There's certain risky behaviors. So it's like what we're going to have to learn, just like the community that's living with HIV has already learned, that I have to avoid risky behavior. That means that you have unprotected sex. You don't do things like for folks that are IV heroin users or drug abusers. You don't share needles. That's risky behavior. Well, what's risky behavior for coronavirus? Getting up in somebody's face more than 6 feet, if you're 6 feet without a mask on, that's risky behavior. Touching things all around that you don't know nothing we're not as clean, and keeping, that's risky behavior. So avoid risky behavior, y'all.
So keep in mind there's a difference in risky behavior in terms of the sexual behavior and the things you were talking about with HIV versus the other. Because if you're just joining us, they go, oh, wait a minute.
What are they talking about? Yeah.
The risky behavior is a common thing, but the risky behavior is quite similar in terms that it will harm you if you don't take precautions.
And that's anybody. Universal precautions.
Right, but with HIV, the risky behavior was related to sex.
Gotcha. So I wanted to make sure that we take time we do have a question that was actually texted in. So Johnny, I want to make sure that we get that question in so they can be answered.
Yes. So question that just came in through text was, with the social distancing, this is for Dr. Victor, how long do you actually, or I don't know if he can answer it specifically, but how long do we plan on doing the social distancing thing? I think the question was, there are a lot of conflicting stories about how long this social distancing is going to last. And they just wanted to know, do you, from a medical standpoint, have an idea of how long this could last?
Well, here's how you think about this. Right now, we're looking for and trying to develop treatments and vaccines. Just like back when there was a flu epidemic back in the beginning of last century in 1918, and so hundreds of thousands of people died also. But there's some cities that social distance, and there's other cities that didn't social distance. The folks that didn't social distance, there was more death. And the folks that did social distance, there was less death. So the end point's going to be, what you'll need to be listening for is, when are we going to have an effective vaccine? And there are three parts of that. You got to see if the vaccine is safe. First of all, we can't be trying to kill people, trying to save people. Next thing is, you have to make sure does it work? Okay, and then
Yeah.
you can get it to a number of people to get the immunity up. Now that's the vaccine side. Now a lot of folks don't like vaccines; they think it does things to them. Okay, fine, whatever. But the bottom line is that the other thing is that treatment. That if we can come up with an effective treatment, then we can put the brakes on this. If we can really say, okay, this treatment will, that this means even if I do get sick, I can have a treatment that will get me better. And so
hold on, Dr. Victor. It seems like we're experiencing some technical difficulties. We can't see you. We can hear you just fine, but we can't see you. Is there something going on with the camera icon? Because we want to make sure that we can see you as well.
green light. I see you. I don't see Johnny.
Hi, can y'all see us?
Can you tap your camera icon again?
Camera icon? What's the camera?
Oh.
No, I can see them just fine, but we can hear them. We just can't see them. So I'm not sure if it's something going on with their camera. No, just bear with us. Yeah, I can see them, but I can hear them just fine.
Yeah.
We can't see them.
Can't see you. Yeah.
Is there anything going on with your camera icon?
No, not a thing. You mean
there we go.
Okay, there it is.
What happened?
I'm not sure.
Not sure, but we can definitely see you now. So we want to make sure that we get back to Dr. Victor.
It'll turn into a radio program. 5 seconds. In any case, as I was saying, what I was saying.
You were talking about the vaccines, whether it's safe, whether it's effective, and then
to go back to that, when it's like any medical condition that's infectious. The reason why you can social distance with typhoid, you don't have to social distance with certain medical conditions, like typhoid or whatever, is because we have a treatment to stop that. Once we have a treatment, then you could the reason why people are so distant because they don't want to get themselves killed and don't want to kill somebody else.
And we don't have a vaccine.
Yeah, but if we have a way that says, well, even if I do get sick, there's a medicine to get me better, or there's a vaccine to keep me from getting sick from the first beginning. That's my guess. We're several weeks within it, but there's a way to figure that. The other way to figure this out is we got to figure out who's immune and who's not.
So how long?
Yes, several weeks away. It's still several weeks away. It's still several weeks away for us to really begin to get this. To get this now in an emergency, they might try to roll out stuff sooner. And I remember how,
but it's risky.
Say
rolling it out sooner could be risks.
Yeah,
involved with that.
Run something out. There's just gonna be so that the other alternative is to get and check people's antibodies to see who's been exposed. Once we know who's been exposed and know who's been exposed and whether or not, if you get exposed, you are immune. You won't get sick again. Once we know, and that's why we need to do massive testing, so we know who's got it, who's had it, who's had it, either, so we can know who to social distance away from. If I know that I've been exposed, then I can say, well, I know I need to be extra careful. Or if I've been exposed and I don't, and I have immunity to it now, then I can actually jump at the front of the line and jump ahead of my colleagues in dealing with people with infections.
Gotcha. So I understand that we have another question from one of our viewers. Johnny, you want to take that?
Yes, we do. So another question that just came in is, with all the signs that have like 6 feet apart, how concerned should we be, like when we're out in public, and if somebody walks up on us, should we like be at the point of get away from us? That's literally what the question says. Get away from us, or how do we respond to those types of things, like with the 6 feet apart?
Run.
I just think it's funny. No, I think it's funny because literally the question says, Should I start fighting people if they get up on me?
Mask, then you ain't gotta start fighting. Put a
But
mask
if they
on,
don't
y'all.
have a mask,
Well, at least as long as you got a mask on, you
well,
don't
if
have
they
to
don't
run.
have, you have a mask on, and they
At
didn't
least
have
that
a
keeps
mask.
people breathing on you.
But
Everybody should have a mask.
But if somebody comes up with me without a mask, I'm moving. You know,
There's nothing wrong with moving, stepping to the side, but you're safer with better. It's better to have them come up for you with a mask.
Yeah, if they have a mask, but if they don't have a mask, no, I'm gonna have my mask.
Okay, no, it's so.
But they need a mask.
So yes, everybody needs a mask, but as we can see, folks ain't doing that. I don't know.
So
I don't know why. You know.
So we have another question for Dr. Sherry from one of our viewers.
So it's kind of a piggyback off the last question. So the question is, with everybody with the 6 feet apart, Dr. Sherry, what do you feel the future mental impact this is going to have on people interacting with one another?
It's going to be, unfortunately, it's going to have a lasting impact.
Did we disappear again? Are we still here? You see us?
You're here. We can see you.
All right. Because every time you ask a question, we disappear.
Well, back to the question they asked. I think it's going to have a real impact because we're still grieving. We're going to be grieving long after this, all the losses and all the family members and loved ones. But also, it's going to change how we interact because we don't know once it's gone, is it gone for good? How do we impact and this whole idea of being isolated? Some people are isolated with families, and other people, if you're single, you're isolated by yourself. So it's really going to have either once we're out, everybody's going to sort of rush to each other, or people are going to be very cautious about how they move towards each other. Depending on the individual, but trust me, emotionally, it's an impact because people are really trying to recreate that new normal. What's going to be comfortable for them?
Gotcha. So something you said, Dr. Sherry, that when we try to come back together, and even you too, Dr. Victor, when we have people who are talking about, no, I'm sorry, this is for Dr. Victor. When we talk about people who have been infected already, and they've had COVID-19, they've gone through the process, they've actually gotten better. What are the chances of reinfection?
That's the question. That's what part of the $64,000 question. And these are the questions we don't know yet. We don't. The honest, that's why they call it novel, because it's new, it's different. It's there. Like I said, there are other coronaviruses out there, but this one is a new one. And this one here is such a way that we don't know whether or not that those are the unknowns. Who gets it? Who gets who's infected? If you're infected and you get better, can you continue to spread the virus? We don't know the answer to that. And that's why I say before we even start talking about when the social distancing thing is going to stop, that you can't even get into asking that question until you know the basic how this virus breathes. And we don't know enough about how this virus breathes yet.
And until we know that, we do have to keep the social distance going.
It's working. And
we are sharing some really, really good information. If you're just tuning in, or if you're watching now, make sure you like, share, subscribe, and comment to David and Johnny on our YouTube page right here. We're talking with Drs. Victor and Sherry Blake. Dr. Victor is a medical doctor right here in the Atlanta metro area, and Dr. Sherry is a licensed clinical psychologist here in the Atlanta metro area as well. They have agreed to join us to make sure that we can answer your questions effectively and appropriately from the mental as well as the physical side. So when we talk about the people who have maybe lost loved ones and they're hearing that they, due to social distancing, they won't be able to say goodbye to their loved ones. They won't be able to gather for any type of funeral or any type of processional or anything like that. What do we say to those people? Because is there a medical fact that once someone transitions and they're actually there for, their body is there for viewing, that other people who are now coming to view them, they're saying that we can't touch them, we can't get close to the casket. What is that about? Is that something new?
Although, unfortunately, generally speaking, when a person passes away from pretty much any medical condition, there's some, with rare exception, the bodies are okay. But again, we don't know about this one yet. That's still we don't know. Does the body remain infectious after death? Scientifically, we think not. Our leaning is to think not. But right now, being scientists, we need to be able to answer that question.
Well,
yes or
one
no.
thing is clear: they're not going to breathe on us.
Well,
They breathe. And so you don't have to.
Listen, we're not laughing, we're crying. So I completely understand. We want to make sure that we are we're culturally sensitive, yes, but we want to make sure that we at least add a little bit of brightness to your day as well.
Because you know us, we want to jump you.
I'm just trying to say, as he's thinking it through, I was trying to help him think it through.
Gotcha.
That's all.
That's all.
That's all. Nothing more, nothing less.
And I know people like to even where everybody want to go to the casket, touch it. I understand that, but right now, even that. Even that, yeah. But I'm saying right now, you have only it's about 10 people.
But what is sad is this is a real tough time because as African Americans, especially, the funeral and the grieving, that's the send off, the way to really say goodbye. And it's not just about the loved ones gone; it's about the ones that are there, the support and to have that support system, around you. And that's very difficult. I heard someone on the news recently said they had to bury their loved ones and they did a graveside burial. And it was so odd to only have a handful of people there. And then everybody had to go home to their respective home. There's no, hugging and gathering and lingering and, so that's whole different. And so we're going to have to really look at our grieving process and what's going on and how do we deal with that, So with all of that being said, all this is new.
Well, yes.
Everything is new.
Well, then let me ask you something.
There's a question from doctor to doctor.
Okay.
Yes, that's Dr. Lake.
Yes.
Yes. With people, that's how people get closure. What can they do to try to help get better closure in absence of this? You know how I know how funerals can be. We can
And that actually, Dr. Victor, goes in line with the question that just came in as well for Dr. Sherry. Do you agree with the virtual funerals that we're now having to go live on Facebook or Zoom to be able to have the viewing that most people, if you're not within those 10 people that are allowed to be physically in that space, do you agree with that from a mental standpoint?
That's hard. That is hard. And I think that's an individual call. I mean, it's like, you just have to be, you're there, but you're not there. It's like you have to be there. Have you ever been to church and you get there? You have to be in that, outside.
The overflow.
Then the overflow room.
Yeah.
It's like, that was nice, but it's not the same. So same thing with funerals, but I think we have to be very mindful that in this day and time, we may not have, that may be the next best thing. And it's very hard and it's very sad, but I don't know if I would want to see my loved ones, on video, but that would be very hard. That's a hard call. I think that's an individual call.
Gotcha. So when we talk about the new normal that I believe everyone around the world will experience once this thing starts to decline, whether it's from social distancing or we've created the vaccine that is now helping people, this new normal is what some of us are still trying to wrap our minds around. What will the new normal become? And how will we be able to handle this new normal?
Well, I think the new normal is evolving. And that's the thing. It continues to evolve. It's, one problem with the stress and the anxiety we have is the forever thing, the changes. Things are changing constantly. And as a people, we pretty like to know where things are and be where we can count on it being the same today as it is yesterday. No, but this, with all the changes, no one knows, and it makes it, and it does, it makes you feel you don't feel safe because you're not in control. And it's like you're on a roller coaster ride and you don't have any control when it's going to stop and if you're going to get off. And so I think that this new normal is something that's going to be forever changing. It's not going to be overnight. Say, if this is the new normal, now we can all breathe and get adjusted to. But we're not getting adjusted to it because it's changing, and that's okay. Change is going to have to be okay.
Yeah, this is
so.
Go ahead.
So, if there was, Dr. Victor, one thing that you would like for people watching this video to take away, what would it be?
Well, understand that that behavior, your own, because people want to know, well, with all these things that happen, what can I do to protect myself and my loved ones from this? And that it ultimately is still going to boil down to your behavior. I still see far too many people walking around without masks, without gloves, and touching stuff and going all right. I see far too many people doing that. Doing that. So it's in your hands. I mean, you want to look at your hands and say, these are the hands that's going to keep me alive. As I said, the life you save may be your own. So again, behavior. Accept the fact you're going to have to grieve the loss of how things used to be, but it's going to be a minute before we can even think about really shaking hands. And maybe an entire generation before we get over this trauma. And that's why I think that ultimately this is a collective trauma that we've experienced. The same way people who were alive still remember World War II like it just happened. They refer to it as the war. And when you say the war, everybody knows what you mean. Now people are saying the virus. Now there's lots of other viruses, but nowadays we say the virus. Everybody knows what you mean. So this is going to be in our collective memory for a while. So I want people to remember that scientists are we're working hard to get a treatment for this. It's not going to happen overnight, but your own safety is in your own hands, y'all.
Yeah.
Gotcha. Dr. Sherry, one last takeaway?
Yeah, I would like for people to take away the fact that they're not alone. You're not in this by yourself. You may feel like it. And as unsettling as things are, a lot of the anxiety is fed by fear of what happened yesterday or fear of what's going to happen tomorrow. None of us, we can't change yesterday, and we really don't know about tomorrow. So the only thing you can control right now is the here and now. So be mindful and stay in the here and now to try to manage that anxiety as much as possible. I'm so sorry. I am needed.
Okay. While Steve does that, let me just remind people again that I see everybody walking around with gloves, still touching stuff, and then they still rub touch everything.
I do have an emergency call that I do have to take, but I do. Okay. Everyone, listen, be safe and be careful.
Yeah,
Thank you.
She got an emergency, which means probably I'll end up.
You're gonna have an emergency too.
Yeah. But again, with the gloves, just make sure that that with the gloves, one outing, one set of gloves. I know y'all want to take them home and wash them and do stuff like that. That's not going to work. And remember to pull them off from here and peel them off. Do not be doing the strip tease, as I said last time. So that's the only thing I would want to strip tease. Oh Lord, now I'm by myself. Now Sherry.
Well, you did a really good job, Dr. Victor. We want to say thank you to both Dr. Sherry and Dr. Victor Blake for joining us here today. The views and opinions expressed during this video are those of the panelists and should not be substituted for an official diagnosis. For individual treatment, please contact your healthcare provider.